Imagine a person suddenly losing control of one side of their body. Their speech becomes unclear, their face begins to droop. They know something is wrong, but every second that passes is allowing damage to continue inside their brain. A stroke is one of the few medical emergencies where time is directly connected to brain survival. Unlike many other conditions where waiting a few hours may not dramatically change the outcome, a stroke can rapidly destroy brain tissue when blood flow is interrupted. This is why doctors often say time is brain. Every minute without treatment can mean the loss of millions of brain cells. But what exactly happens inside the brain during a stroke? Why does getting treatment quickly make such a dramatic difference? And how can recognizing the warning signs help save someone's ability to speak, move, think, and live independently? Today, we are exploring the critical importance of stroke treatment time, why every second matters, and what everyone should know before a stroke happens. Number 1, what happens inside the brain during a stroke? A stroke occurs when something interrupts the normal flow of blood to part of the brain. Blood carries oxygen and nutrients that brain cells need to survive. When that supply is blocked or reduced, brain cells in the affected area begin to struggle almost immediately. There are 2 major types of strokes: ischemic strokes, which happen when a blood clot blocks a blood vessel, and hemorrhagic strokes, which occur when a blood vessel breaks and causes bleeding in the brain. In both situations, the brain is placed under extreme stress. Cells that are deprived of oxygen begin to malfunction, and if blood flow is not restored quickly, permanent damage can occur. The brain controls movement, speech, memory, emotions, and many automatic body functions. So, the location of the stroke determines what abilities may be affected. This is why one person may experience difficulty speaking, while another may lose movement on one side of the body. Number 2, why doctors say time is brain. The phrase time is brain describes a simple but powerful reality. The longer a stroke continues, the more brain tissue can be damaged. Unlike some tissues in the body, many brain cells have a limited ability to recover after severe injury. When blood flow stops, the affected area begins an emergency process where cells lose energy and cannot maintain normal function. Surrounding the damaged area is a region called the penumbra, where brain cells are weakened but may still be saved if blood flow is restored quickly. This area represents an opportunity for treatment. The faster doctors can reopen blocked blood vessels or control bleeding, the greater the chance of protecting brain function. Delaying treatment can allow the area of permanent injury to expand, increasing the risk of long-term disability. Number 3, recognizing stroke warning signs saves valuable time. One of the biggest challenges with stroke treatment is that many people do not recognize the symptoms quickly enough. A stroke can happen suddenly, and the warning signs may appear different from person to person. Common signs include sudden weakness or numbness, especially on one side of the body, difficulty speaking or understanding words, confusion, trouble seeing, dizziness, loss of balance, or a sudden severe headache unlike anything experienced before. A helpful way to remember common warning signs is the FAST method. Face drooping, arm weakness, speech difficulty, and time to call emergency services. Time is the most important because recognizing symptoms is only useful if action follows immediately. Waiting to see if it gets better can mean losing valuable treatment opportunities. Number 4, the golden window for stroke treatment. The golden window for stroke treatment begins the moment symptoms appear. It refers to the critical period following a stroke when getting medical treatment as quickly as possible can help limit brain damage and improve the chances of recovery. For certain people experiencing an ischemic stroke, clot-busting medication may be given within 4.5 hours of symptom onset, while some eligible patients with a large blood vessel blockage may benefit from mechanical thrombectomy from up to 24 hours, depending on brain imaging and other factors. However, these are treatment windows, not waiting periods. Every minute matters, so if you experience any symptoms, emergency medical care should be sought immediately. Number 5, why calling emergency services matters. When someone experiences stroke symptoms, calling emergency services is one of the most important actions a person can take. Some people make the mistake of driving themselves or having someone transport them privately, but emergency medical teams can begin care immediately and alert the hospital before arrival. During transportation, medical professionals can monitor vital signs, collect important information, and begin the process of determining what type of stroke may be occurring. The faster the medical team understands the situation, the faster treatment decisions can be made. A stroke is not a condition where waiting at home is safe because symptoms can worsen quickly. Number 6, how doctors determine the best treatment. When a person arrives at the hospital with possible stroke symptoms, doctors move quickly because they need to understand what is happening inside the brain. Brain imaging, often through a CT scan or other advanced scans, helps determine whether the stroke is caused by a blocked blood vessel or bleeding. This distinction is critical because treatments that help one type of stroke may be dangerous for another. Doctors also evaluate the timing of symptoms, the severity of the stroke, medical history, and overall health. Modern stroke care is based on rapid decision-making because the goal is not only to treat the immediate emergency, but also to protect as much brain function as possible. Number 7, the long-term effects of delayed stroke treatment. When treatment is delayed, the consequences can extend far beyond the initial emergency. Damage from a stroke can affect movement, speech, memory, emotions, and independence. Some people may experience weakness or paralysis, difficulty communicating, problems with balance, or challenges performing everyday activities. The brain does not have some ability to adapt through a process called neuroplasticity, where healthy areas may help take over certain functions through rehabilitation and practice. However, preventing unnecessary damage is always the best strategy. Quick treatment gives the brain the strongest possible chance of recovery and reduces the amount of injury that rehabilitation must overcome. Number 8, rehabilitation and the brain's ability to recover. After a stroke, recovery often involves rehabilitation designed to help the brain rebuild skills and adapt. Physical therapy helps improve movement and strength. Occupational therapy helps people regain independence with daily activities, and speech therapy can help restore communication and swallowing abilities. Recovery depends on many factors, including the location and severity of the stroke, how quickly treatment was received, and the individual's overall health. The brain's ability to adapt means improvement can continue long after the initial stroke, especially with consistent therapy and support. However, the foundation of recovery begins with the first moments of emergency care. Number 9, preventing stroke before it happens. While emergency treatment is critical, preventing strokes in the first place is one of the most powerful approaches to protecting brain health. Many stroke risk factors are connected to lifestyle and medical conditions. High blood pressure is one of the leading risk factors because it can damage blood vessels over time. Other factors include smoking, uncontrolled diabetes, unhealthy cholesterol levels, physical inactivity, obesity, and certain heart conditions. Supporting cardiovascular health through regular movement, a balanced diet, maintaining healthy blood pressure, managing blood sugar, and following medical recommendations can significantly reduce risk. The brain depends on a healthy circulatory system, so protecting your heart and blood vessels is also protecting your brain. A stroke is one of the clearest reminders that health emergencies require immediate action. The brain is the control center of the body, and protecting it means recognizing problems quickly and responding without hesitation. Acting fast could protect someone's ability to walk, talk, think, and enjoy life. In a stroke emergency, time is not just measured in minutes, it is measured in brain function saved.